When I first moved to Europe from a so-called third world country, I was totally delighted by the healthcare system here. They seem to have everything. Good doctors, clean hospitals, all the facilities. You didn't have to wait too long. I'm sure many immigrants can relate to that. But I was soon to discover that I was mistaken. There's a lot of discrimination and racism in the healthcare system, and a lot of immigrants don't receive the same medical care as other people do. This leads to immigrants living in a lot of pain, living with sicknesses that are not diagnosed, not getting the same access to therapies like other people, and even sometimes preventable deaths. Hello and welcome to AfriTrader. In my videos, I discuss topics that are relevant to immigrants, but also of interest to other people. So if you like my videos, please do subscribe. I'm going to be touching on a few points, and I'm going to be giving examples based on experiences I made or people close to me made. And the first point I want to look at is the waiting time. If you're an immigrant, especially if you are black or a person of color, you might realize that you sometimes have to wait longer than other patients to be attended to. Sometimes this is done very smartly. Like you could go to a doctor that has 3 or 4 patient rooms. So what they do is when they keep you in the waiting room for a period of time and it's becoming obvious, they'll quickly put you in one of the patient rooms and they'll keep you there, but they'll be busy attending to other patients so you don't get attended to. And when you go to the hospital for an emergency, you might find yourself waiting longer than other people. I once made an experience with my son when he was about 3-4 years. He had an asthma attack and I went to the emergency with him, and he really wasn't breathing well. So every time the nurse would come out, I said, "Could you attend to my son? He's having difficulty breathing." "Yes, we're coming. Yes, we're coming." And when the doctor came out and I spoke to him, he told me that no, he's taking the patients one after the other as they came. But I pointed out to him that that wasn't true. Some people had come after I came, and he wasn't really going to tell me that a slight cut on a finger would be more of an emergency. This doctor came out, looked at my son and told me, "You as a mother should see that your son is breathing properly." Finally, when he called me into the room and examined my son, everything suddenly changed. They started putting my son on, to inhale, one gadget here, the other gadget there. "Oh, it's really bad. He needs to be put on admission." I was just looking at this doctor like, are you kidding me? So you need to be very aware of this. They often keep us waiting. And sometimes people may go there with a serious problem, not be attended to. There are even cases where people collapse at the doctors or hospital and die because they were not attended to on time, because they were simply not taken seriously because they were immigrants. Another point I would like to touch on is the attitude of the doctors to pain when it comes to immigrants. They don't take us immigrants seriously. And you know that pain is always an indication that something isn't right. If you go as an immigrant to the hospital and you complain of pain to your doctor, they often wouldn't take you seriously. They'll think like you are simulating. Now, this is a very serious issue. You will see cases that women are in labor and they will make comments like, oh, you know, black women, you are used to giving birth, you know, they give birth in the bush, so they won't give you adequate pain medication. You may have a sickness and the pain is indicating that obviously you have that sickness, but because they don't take you seriously, they won't diagnose it. I suffered with pain for over 2 years before a doctor took it seriously and decided to test for arthritis. Because I would go there saying my limbs are paining, my joints are paining, my fingers are stiff in the morning. Oh, but you know, you can move your fingers now. They didn't take me serious. And they also don't give you adequate medication for pain. Or sometimes you may have a case that the doctor will just pump you with pain medication without even seriously looking at what is causing that pain. They even extend this to children, and that could lead to a lot of serious issues. Another important point is that sometimes the doctors don't trust immigrants. Now, for a doctor to treat you properly, you have to trust the doctor, but the doctor also has to trust the patient, that the patient knows what they are talking about. And if this doesn't happen, even a life can be endangered. Once a child I had got a cut on his Once my little son got the door slammed on his finger. So he had a cut just about here on his finger. And when we went to the emergency, they said they had to operate. I told them I wasn't comfortable about the operation because my son had had an asthma attack a few days ago. And, you know, I had this feeling that the anesthetic might be a problem. They were like, what do you even know about asthma? It's no risk. If you don't agree to the operation, he might not feel hot or cold on the tip of his finger. So we would have to call the child care authorities because you don't have the interest of the child at heart. So after all that pressure, I finally consented. They said the operation would last like 30 minutes. I was waiting for over 3 hours. And at a stage, I saw them wheeling out somebody from the theater. And you know, there were a lot of hoses, tubes, machines attached. And I was like, oh, this poor child. You know, thank God my own is just a finger. This must be serious. And then I took a glance. It was my son. Meanwhile, before they wheeled my son out, the surgeon came out and had told me the operation was a success. So I was like really happy and relieved. And then I saw my son being wheeled out like that. Then the anesthetic doctor came out and I was like, what is going on? What is going on? They said, oh, his heart didn't really play along. Till today, nobody ever told me what happened in that theater. My son was in the intensive care. He didn't wake up till the afternoon of the next day. They had to keep resuscitating him. All this happened because they didn't take me seriously They didn't trust me as a mother, that I knew what I was talking about. And not just that, that brings me to another point. Just look at the way they broke the news to me. Is that not the height of disregard for a human being, for a mother? For a surgeon to come out and tell a mother the operation was okay. On the finger. Yet you didn't prepare me for the fact that in the attempt of stitching a minor finger wound, an even greater damage had occurred. I just have to add this, that the stitches burst open a few days later and the wound eventually healed on its own. So that operation for me was totally unnecessary. And there was total disregard of me as a mother, total disregard for me. Normally, after such a thing happens, you would come out, take the mother aside and break the news to her. None of that happened. Total disregard. And that's discrimination and racism. This brings me to the topic of becoming a guinea pig if you are not careful. That's why I would advise, if you are sick and you are diagnosed with any sickness, please take the pains to go and read up about that sickness and consult other doctors. Because if care is not taken, you might end up being a guinea pig in this system. I have a son that is hyperactive. And so, because there were a lot of issues in school, the school called in a psychologist, and they came up with a lot of theories, and so they said it would be good if he was admitted in hospital. They'll run a lot of tests and observe him to know really what the issues were. So at the end of this 1 week observation, they told me, no, he's really a balanced child, very caring, attached to his family and all that. But the doctor said, well, since he has been diagnosed with hyperactivity, ADHD, she would suggest that they put my son on clonidine. Now, this is a medication that is not allowed in Germany to be used on children. It's not allowed for children, but that they would like to try it, and that is normally a medication used for high blood pressure. So my son would have to stay on admission, and they would, be giving it to him, administering it to him, and observing him because he could collapse or something. And I said, my son had been having 1 or 2 therapies because he was hyperactive. But he had never really been on medication like Ritalin or any of these other medication. So why do you want to go to such a medication that is not allowed for children in this country? I'm not a doctor, but I know that if you start administering a drug for high blood pressure to somebody that doesn't have high BP, he could start having high BP and such problems. They said, yes, it's a possibility. And I said, why my son? I took my son out of there and I rejected the therapy. Only for me to go and do my research and find out that that clinic, that hospital, was trying to run tests on the medication, trying to run tests with children on that medication because they wanted it to be approved in the country. If I had been that stupid or naive, I would have allowed my child to be used as a guinea pig. So you have to be very, very careful. Very often, they might ask you to do operations that are not necessary, or give you medication that is not necessary, overdose you. Please be on the watch for such things. One issue I'd also like to address is that a lot of doctors and nurses are really disrespectful when it comes to immigrants. And very often, female immigrants experience this, especially when you are pregnant. You go to the doctor and he'll start lecturing you on why do you have so many kids, you can't take care of them, make rude comments, wouldn't talk to you in the proper tone, wouldn't address you properly. I mean, when you encounter disrespect, it's very hard for you to trust that doctor or trust that you are in safe hands. And when you notice such a thing, you have to ask for a change. Look for another doctor. Because this lack of respect can lead to a lot of health hazards. Because when somebody doesn't respect you, he's not going to give you the adequate treatment. He's not going to treat you like a human being. Because the tone of the voice, the comments they make, a lot of time body shaming women, telling women, oh, you are too fat, or I even know of a case, a woman had to do a swab test, and she was all swollen up down there. What this doctor did was to start, he couldn't really get in there to do the swab test, put in like 3 of these, I don't know what these long things that look like a shoehorn are called, putting it in the private part. The nurse was pulling on one side, he on the other. This on a heavily pregnant woman, trying to take a swab test, until the nurse had to say, doctor, that's okay. This was done out of disrespect. Or sometimes you'd see the doctor examining a case of, just telling the woman, oh, just strip naked, when there are a lot of people in the room. All these things boil down to lack of respect, and you have to be on the watch out that the doctor treating you has that respect for you. One issue of great concern also is that the doctors break the code of confidentiality when it comes to immigrants. You'd see a doctor discussing your issues when he's not allowed to as a doctor. Once I was in hospital on admission, and I had this lady taking care of my kids when my husband was going to work. Now I asked her to take the children to the pediatrician for their usual checkup. And when she got there, the doctor started telling the lady that, oh, this lady, the mother wants its son to start school this year. I don't see why she would want to do that. The boy can't hop on one leg. And started discussing my son with the woman. And this woman came to the hospital to start advising me on whether I should send my son to school that year or not. And, I said, and how do you come on that? She told me, oh, the doctor told her. I had to go back and meet the doctor and tell them that I was going to make an official complaint to the board. He didn't have a right to discuss my child with anybody. They often do that. Or sometimes you would even see cases where people that are on asylum are referred to a particular doctor and they go there for treatment, thinking that what they tell the doctor is confidential. The doctor is going back to tell the authorities and the people in charge of the asylum home, oh, this person has this sickness, and this person has that, this one is coming too often with her child here unnecessarily. One has to really watch out for that. And if a doctor should do that with you, please make sure you confront the doctor about that, because it's really, really wrong. That's enough for the doctor to lose his job. Then let's look at this issue of not examining a patient properly. Sometimes you go to a doctor as an immigrant. The doctor is not even going to examine you properly. Just, send you away telling you, oh, that's okay, or go and take some paracetamol or something like that. You have to insist that the doctor examines you properly. And I'll give you an example. Once, my little daughter, she had this stomach flu. So she had been throwing up and stooling. She was just a year plus. So I noticed, she was kind of unsteady on her feet. So I rushed her to the hospital. And the doctor just looked at my child and said, oh yeah, that's okay. Take her home, give her a lot of fluids, and she's okay. I said, no, she's dehydrated. Look at her skin. The woman looked at my daughter and said, but she's not pale. And now my daughter is really dark, And I said to her, now, how do you expect my daughter to look pale? Can't you see that she's not even standing properly? Look at the skin, touch it, she's dehydrated. Doctor said, no, it's okay, just take the child home. So I insisted. I said, okay, if I have to take my child home and you don't want to test properly, give it to me in writing, because if anything happens to my child, I'm coming back for you. And then she hesitated and said, okay, let me do a test. And suddenly my child was rushed into the ward, put on a drip. If I hadn't insisted, I don't know how that story would have ended. And even while we were there on the ward, back to the disrespect, it still came to play there. The nurses said, she was really throwing up. Anything you give her, she would throw up. But after some time on the drip, the nurse said, okay, try to give her this bottle of milk. So when I gave my daughter this bottle of milk the next day, she just drained it down. Boom. I went back, give me another bottle, because they said if she finishes it, ask for another one. Give me another bottle. She drained it. Give me another bottle. Then by the third bottle, they said, no, you're lying. That baby's not drinking that milk. You must be drinking it yourself. Now imagine that I would be sitting beside my sick child, drinking the baby milk from a bottle. I said, excuse me, what are you trying to imply? Yeah, you must be drinking the milk yourself. We are coming along to watch. Then they came and saw that the baby drank the milk down again. And so they said, okay, but it's too much milk. Let's give her tea. Imagine that you take a sick child to the hospital. First, your child isn't being diagnosed properly because the doctor can't be bothered. And then the nurses are accusing you of drinking the baby milk. All these issues are normally intertwined. Also, very often you'll notice that A lot of doctors have this prejudice. They think that immigrants are stupid. So they don't bother discussing with you or really telling you the options you have or what they are doing. Just like when my son was anemic and he was in hospital, they kept us like 5 days in the hospital. And I kept asking them, but why are we here on admission so long? I mean, he can be drinking this iron at home. Oh, we're testing for a very rare sickness. We have to wait for the results to be out. We're testing for a rare sickness. I said, yeah, so what are you testing for? Oh, no, you wouldn't know. So it's so complicated. We can't tell you, but we'll, let's carry out the test. We'll tell you. Eventually, when they came on the 5th day, they told me, oh, we were suspecting your son might have sickle cell anemia, but he doesn't have it. And I was like, my goodness. You mean you kept me 5 days in this hospital extra testing for sickle cell anemia? But why didn't you just ask me? Because if you had asked me, I would have told you that it's not possible because I'm AA. Because this sickness you think is so rare, for us in Africa, we're very aware of it. This again was discrimination. And another aspect where discrimination comes into play is that doctors always assume that because you come from Africa or so, especially if you are new in the country, you must have a terrible sickness like HIV or so. And confront you with such things. They have those prejudices. Oh, coming from Africa, you must have HIV or one kind of sickness or the other. When I first came from Nigeria to Germany, my son had an asthma attack, so I took him to the hospital. And then the next thing the doctor said was, when I came, was like, oh, we have to do a tuberculosis test. I said, oh God, I brought my son here for asthma. You're now talking of tuberculosis. How do you come on that? Oh, we saw traits of tuberculosis in his blood, but it may be from the tuberculosis inoculation, but we still have to go for further tests. I said, well, my son was inoculated adequately as a child in Africa, but, go ahead and do this test because they said they may have to isolate him and all that. So the day later when I came, the doctor said, oh yeah, we also want to do a HIV test. And I said, now how do you come from asthma to tuberculosis and now to HIV? So, he showed me this map and, areas marked red, that those are like the areas where they have HIV. So based on that map, they would want to do a HIV test. And I said, okay, go ahead and do the test because, it was just getting so absurd. And I got a call. I was at home, I got a call. Come to the hospital immediately, it's urgent. I can't begin to explain how upset I was, how scared. I was trying to imagine what could have happened to my son. Could somebody have, given him an injection in Africa with a needle that wasn't sterile, or somehow, how could it have happened? Only for me to get there and the doctor to come with his entourage and tell me, yeah, my son has a real bad allergy against dust, against this. I should go home, throw away all my rugs, my curtains, this, that. So asking, well, doctor, wait, hang on. What about the HIV? What about the HIV test? He said, well, it was normal. I said, okay, normal means he has HIV. The doctor said, no, why are you being funny? I said, no, because based on your map, normal should mean he has HIV. The doctor said no. And I said, okay, what about the tuberculosis test? Oh, they didn't do it again. I said, well, doctor, someone can still have tuberculosis without having HIV. Why didn't you do that test? So you can see that all those tests they were talking about also, they were not really because there was any objective reason to believe the child had those things. But it was all based on discrimination. Another aspect I want to touch on is the attitude of doctors towards this topic, circumcision. Most doctors would try to use any opportunity to check on any young female patient to know if they were circumcised. Now, I'm not saying in any way at all that female circumcision is right, but the way they go about it at times is not really okay. I once rushed a child to the hospital. This child was about 8 years. The mother wasn't around. The child was sick, so they said they had to admit the child. Now, in the process of examining the child, they just pulled down the slip and started examining her. So I really got angry with the doctor. I said, listen, there's nothing this child has that would make you to be looking there. And secondly, before you take down the slip of a child at that age, you should talk to the child and tell her, oh, don't be scared, I want to examine this. So you see how discrimination always intertwines different aspects. This suspicion, checking for circumcision, intertwined with this disrespect for the child. It all comes together. And the final point I want to raise is this issue of, trying to virtually impose birth control, permanent birth control on immigrants. And they often do this with such pressure that quite a few women have gone on to do this permanent birth control and regretted it later. You can't just ask a young woman in her early 30s to think of a permanent birth control. I know many women that have done it and gone into depression later and tried to reverse it. Not only do they do it, but you can imagine a situation, a woman has just given birth in the hospital, and you tell her right there in the hospital, oh, think of this option. Now you can imagine that after giving birth, a woman is weak, a woman still has full memory of the pain. It's very easy to convince her at that stage to do it. But that isn't really right. Such a step, a woman should think about it for some time, even months, before considering a permanent birth control. If you are a woman, please, for God's sake, don't let anybody talk into a permanent birth control when you have just delivered your child, because you are not in the right frame of mind then. Normally, even if a woman commits a crime directly after giving birth or so, the court will look at it differently. You are not in the right frame of mind. Your hormones, you may be having depression, you're weak, you are still fresh with all the pain. That's not the right time to take a decision to do such a thing. Such a decision should be properly weighed, thought about, discussed. You should even get advice on it, professional advice. And that's also a form of discrimination, because these are human beings and they don't want too many of us in their country. So you have to be aware of that too. So I think I've, highlighted on enough points to make every immigrant aware that this health system is it's not as rosy as you think. It may be very good, but is it good for you? Are you being discriminated? Is racism coming into play? Please be on the watch out, because honestly, your life could be at stake. Your health could be at stake. You could be going through years of pain just because you were not diagnosed properly and you were not treated properly, because nobody really took the care to regard you as a human being and give you adequate care. I'm not saying this applies to all doctors, but there are more than enough doctors and nurses where this is the case. So please be on the alert and be conscious about your health and educate yourself about your health.